Hi, I'm Theodora Scarato. I'm Executive Director with Environmental Health Trust, and I'm so thankful to be here today and to speak after this great introduction to electromagnetic fields and health. And what I want to talk to you about today is solutions that are in place, reports that have been made, and with a focus on schools. Environmental Health Trust is a scientific think tank. We both publish research, do public awareness programs, and also give briefings to policymakers and governments around the world. So this is a picture of St. Augustine School, I believe in 2015, when they ceremoniously removed the Wi-Fi router. And there are the parents looking on, and there's a large news article on this that you can go online and read about. This is happening all over the world, where within individual schools or governments are making changes in schools, because of course children spend the majority of their time when they're not at home in schools, so it's an important area to focus on for children's health. This is a picture from a video extolling the virtues of bringing Wi-Fi devices into the classroom. It's Baltimore County School website, and I'll note the unhealthy postures of the children, as well as the eyes close to the devices, because we're spending billions to bring devices in, but we haven't built the infrastructure in a safe way for children to access this technology in the safest and healthiest way possible. This is another picture with children sitting on beanbags with the devices on their laps. And as was mentioned before, all wireless devices have fine print warnings that recommend, that talk about the radio frequency radiation exposures and how not to exceed our government limits which are outdated and 20 years old based on 30-year-old science. So this is some scientific imaging done by EHT and engineers from the Federal Universities of Brazil, showing the penetration of radiation into the tissue of a body of a man from a Wi-Fi laptop on the lap. Usually Wi-Fi laptops say, I know my PC says that it should be kept at a distance from 20 centimeters from the body, which is about 8 inches. Yet most people are not aware of that. It's deep hidden in the manuals or in the operating systems. And there are actually some schools where they are starting to ensure that the parents and teachers have access to that because of the liability issue. But if you take a look at this picture, and I'm sorry, there's actually an animation online. We have a YouTube playlist where the scientist is actually explaining this work. And I clipped this because we're using a PDF, and so the scale is actually 10 volts per meter. But if you look at the yellow, that's the highest rate of absorption into the body. Then it goes to orange, to red, to purple, to blue. So where a device is very important in terms of what exposures you get. And I'm thankful that I have been spearheading this issue with the Children's Advisory Council, the Children's Environmental Health and Protection Advisory Council of Maryland. And this is the first state body to make recommendations on addressing Wi-Fi in schools. So they issued a report in 2017 that the Department of Education should consider using wired devices, and most importantly to all the architects and building folks and design, when you're doing a new build or when you're modernizing, that is the best time to put in the wires so that you can access the internet and connect your computers. So for example, if I were building this auditorium, you could actually run wires underneath so that each of these desks had a place you could just plug in your computer rather than using Wi-Fi. I'm thankful that my school has actually removed the Wi-Fi and they've installed ports. So when we go to the library of my children's high school, there are actually wires, which I love to see in the library. There are these Ethernet wires hanging, and you can just go and plug in your computer. You have internet access but you're not having the radiation from that internet access. The Collaborative for High Performance Schools developed low EMF criteria in 2014, addressing two types of electromagnetic fields. One is extremely low frequency fields from your power lines, from your electricity. So you can address that by dealing with any wiring errors that you may have. You get an electrician, and they have an extensive list of actions you can take on that. When you correct those wiring errors, you can lower the magnetic fields. As well, they talk about best practices for devices, keeping them off the lap. And it's important to remember that all of our electronics have electromagnetic fields, and they have two main types. There's the magnetic field and paired with the electric field, the extremely low frequency fields. And then the radio frequency from the Wi-Fi. So if you turn the Wi-Fi off your device on airplane mode, as I use my device almost all the time, you're still getting the ELF. So it's important that the device not be on your lap. So even if you have the Wi-Fi off, put it on a table, put it off your body, put it to the side, or put a barrier of some sort, and that can decrease the magnetic field significantly. The Collaborative also has, where am I in time? 30 seconds. Addresses Wi-Fi to use wired internet rather than wires, and also to hardwire all your phones rather than use cordless phones. This is just the website of the Baby Safe project, which is a joint initiative of Environmental Health Trust and Grassroots Environmental Education, with attention to the published research that shows impacts on the brain, and especially because pregnant women are most vulnerable. The fetus, the developing baby, is most vulnerable. And Dr. Hugh Taylor, who's chief of obstetrics at Yale Hospital, presented his research that showed mice prenatally exposed had poor memory and more hyperactivity. And I invite you to take time to go to ehtrust.org and to the Baby Safe Project and to learn more. All of the brochures are in the other room, and I think my time is up, so thank you.
Thank you, Theodora.